At Capella University, you're in control of your education. With the game-changing FlexPath format, you can set your own deadlines and move at your own pace. The faster you move, the more you save. Visit capella.edu to learn more.
What goes into making celebrations with your family great? Kohl's has the answer. Discover super comfy bedding from the Big One for your guest room, Keurig coffee brewers for mornings spent together, and Bissell floor care for cleaning up after the fun is over. Oh, and really great gifts your family will love. Order online at Kohls.com and choose fast and free store pickup, or head to your nearest Kohl's store today.
Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. Today, here with Dr. Millicent Ravello. Dr. Ravello, how are you doing?
Doing excellent.
We had a big day today.
We did. We had a big day. We had a little combined surgery situation, you and I. And then just a lot of patients.
This is going to be a big run into the holidays.
Yes, this is when everyone comes in trying to get their surgeries lined up before the end of the year for two reasons, really. Number one, there are some holiday breaks coming up for kids and for work, and so people reasonably, want to take that time to recover from surgeries. Number two, some of my insurance patients have met their deductibles, and so now anything they do is essentially not free, but significantly cheaper since their deductibles have been met. The problem, it is November 3rd, as we are recording this. Those time slots are filled. I mean, my patients, they come in and they're like, oh, I want to have surgery before the end of the year. I'm like, oh, my friend, you should have been here in July or August, because that's when people started planning for it. I mean, there's still time, and this is actually the time of the year when a lot of us do operate on Saturdays just to squeeze people in.
Oh, yeah. No, I think I have a bunch of Saturdays coming up.
Yeah, a bunch of Saturdays. Operating around the holidays, I don't mind it, but I don't like operating right before a major holiday. Like there was, putting a big case on the day before Thanksgiving, not my favorite thing to do, because
how about no?
All surgeries have the potential for complications, and they happen rarely, but Murphy's Law, it would happen on the patient the day before Thanksgiving, and then you're calling the crew in on Thanksgiving Day, and nobody's happy. So
yeah, that doesn't go over well.
Operating around the holidays is fine, but operating the day right before, 2 days before, especially if it's a big surgery, not ideal.
Well, one of the operations that you do a lot of that we're going to talk about today, and you'll probably be doing some Hollywood-style breast reductions coming up, if you want to call it that way, is these itty-bitty breast reductions.
Yes.
These like little tiny...
Little,
we just need to make it a little smaller.
And they're so cute. I call them my itty-bitty breast reductions. And they fall into two camps, really. It's the women that come in requesting a breast reduction that don't have classically enlarged large breasts. I'm used to seeing the really large breasts that really need to be reduced for problems with back pain, neck pain, shoulder pain. But these women are coming in sometimes with legitimate symptoms, even though their breasts aren't that large. But in general, these patients aren't that large. They're normal to thin patients with breasts that are just a little bit too big for their bodies. And so they're requesting a breast reduction. So that's one category of little breast reductions that I see. And then the other one is this trend I've noticed this past year, more so in the younger patients that come in with nice sized breasts, not exceptionally large, C, D at the most, and requesting really small breasts, not because they necessarily are having symptoms, they just like the look. And I always ask my patients to show me photos of what they're thinking of. And when they show me photos, I can almost predict the photos that these girls are going to show me. It's young women wearing sports bras or crop tops with no bra and very small breasts. And it's a look that they're going for, that athletic, no bra, small but perky breasts. A little bit of volume, but not too much. And so just in the way that a breast augmentation is very much a look that women